everybody. This is Dr. Marianne Pinkston, and welcome to The Better Life with Dr. Pinkston. Today, I've got a great topic for you guys and for you men out there, something that is a hush-hush. It's not talked about very often. It's Peyronie's disease. Peyronie's disease is a very difficult disease for men because there's curvature and pain of the penis, and it is caused by some scar tissue and injury. And I am bringing in a wonderful expert today, Dr. Jeff Twidwell, who's going to discuss Peyronie's with me. And welcome in. It's nice to see you this Monday morning.
Thank you, Marianne. Pleasure to be here today.
Absolutely. I had a post-Super Bowl win for me today. I'm very excited for my Chiefs, but now we get to get a little bit more serious and talk Peyronie's and talk H100, a great product that I know that you have a lot of passion about. But tell us a little bit about Peyronie's. How does this happen to men?
Yeah, Peyronie's disease is something that is not uncommon, which is interesting because a lot of people haven't heard about it. But the data really shows that up to 3 to 9% of men are affected by it to some degree. So it's a little curious that, again, it's not. What can happen is they can end up having some trauma during that activity, which then leads to scar tissue development, which then leads to the symptoms that are the problems that men see with Peyronie's. So the big problems the guys are going to come into our office with are, I have curvature in my penis.
Right.
I have pain in the penis. And then they also can describe feeling a lump, we call it a plaque in the penis, which is the scar tissue.
Yeah. And so with that, then, and it's something they don't like to talk about either. And I think sometimes physicians don't like to talk about as well.
Well, I think the reason why people didn't want to talk about it in the past is we really had nothing new to really offer these poor men. That was the problem. We'd have these guys coming in who want to be sexually active and their partners are interested as well. And they go, I got a problem. And we'd go, you know what? Sorry. Come on back in a year. And if it's stable, then we'll operate on you.
Absolutely. Oh my gosh, which is mortifying. So what are the traditional treatments that have been used?
Yeah, traditional ones that have been out there there's been a bunch of different oral medications tried, things such as Potaba, CoQ10, a variety of things that really in double-blind studies have never stood the test of time. There's anecdotal reports of this working and that working, but nothing where it's been a double-blind controlled study that really showed good results. Then there was injections historically with something called verapamil, and a newer injection, and people have probably seen the advertisements for it, is Xiaflex. So these are injections that are on the market now. The newest one, Xiaflex, is the one I'd probably talk about briefly. It uses an enzyme produced by the bacteria Clostridium. It's a proteolytic enzyme, so it breaks down that collagen plaque I was describing earlier. So you inject with a needle right into the penis this medication that then breaks down and dissolves the plaque. Right. The problem with that product is it can be effective, but some of the problems that we as prescribers of it have seen are side effects with the injections itself, and I'll be honest with you, fairly modest results in regards to success. Okay. But it is an option. There are certain restrictions. You have to have stable disease, a certain degree of curvature, et cetera, to even be approved. And then the other traditional thing has been surgery, which is either an operation where you straighten the penis. It's called plication. So you're actually not removing the plaque, but if you have curvature, you're actually foreshortening on the opposite side slightly to straighten it. Right. That's a fairly straightforward procedure, and in mild situations that can be very helpful. For more severe degrees of Peyronie's disease and curvature, usually you need to excise the plaque itself and then put a graft on top of that to really get adequate results and not foreshorten the penis and things like that. Right. So those are the traditional things that have been out there.
Yeah, very, very difficult too. And a surgery just sounds horrible. It sounds like a long long time for rehab and things like that, for healing time anyway.
Yeah, especially with the plaque excision.
Exactly.
The placation, patients do quite well with that,
Right.
and it is a very reasonable option in certain men. So
Yeah, for severe cases, I'm sure. But the good news is we know of some more topical effects now, and I think you're going to talk about H100.
yeah, I think there are two things I'd like to talk about, not just the product
Sure.
H100, but also traction devices, which are
Yes.
also, I think, another good option, because I really want your viewers and all to hear the new things that are out there, because there are some exciting new things available for these guys that are suffering from
Absolutely.
this. So the first thing, as you talk about, Marianne, is H100, and that is a product that I developed with the help of PharmDs. And basically what it is a topical gel that's applied to the penile shaft to try and change the course of the disease as it's developing and also after it has developed. So H100 has three components to it. I'll list them and I can go through what they are. It's nicardipine, which is a calcium channel blocker. Number 2 is superoxide dismutase. And number 3 is ultra purified emu oil. So nicardipine, it's a calcium blocker, and it's a specific type called a dihydropyridine. And for your viewers, again, calcium blockers have been used forever for heart problems, for blood pressure, etc. We're using it in this case for its collagenase activity. Collagenase being an enzyme that helps remodel, and break down scar tissue, which again is what this plaque and Peyronie's disease problem is all about.
Yeah.
So we're using it from that standpoint. Number 2, the superoxide dismutase. That's something, using a fancy term, it's a free oxygen radical scavenger, which in layman's terms that's very important in the inflammatory cascade, which is what's really going on early on in Peyronie's disease. If you remember, I said you get an injury that leads to inflammation. Inflammation is what's really firing this all off and starting the whole process. So the superoxide dismutase can affect the process at that point. And then the third component is ultra purified emu oil. And emu oil is very rich in the exact lipid profile for our skin. It's literally the perfect carrier agent. It's crazy how good it is. And it's been used by Aborigines literally for centuries for treatment of skin conditions and scar tissue, especially after burns. And there's medical science to back that up. So basically what H100 is doing is hitting it in 3 different ways to change the course of the Peyronie's disease in these men. So it can be really effective.
Absolutely. And is there a way to, look at it from, kind of the onset? I know a lot of men sometimes two things will happen. Actually, they'll, just watch and wait and see, is this something that's really happening? What do I do? Do I go in now? Do I just wait and see? And then a lot of doctors take the approach too of watch and wait as well. Is there a better time than another to intervene?
Oh, you hit that right on the head. And the problem is, when we didn't have any other options to offer early on, that's really all we could do is say, come back after it's stable. Now we are having some options available. Again, I go back to that phrase, we can change the course of the disease in some of these men. Yeah. So we're not dealing with the fallout of the problem. We can stop it before it gets to that area. So again, I think treating these men sooner rather than later can change the course in many of these people. So when the man, oftentimes they'll notice pain during intercourse, and then let's say hypothetically a week, a month later is when they'll be getting more pain, the scarring will develop. That's when they need to get into their provider and say to them, is there something I can do? And yes, you can. You could start this treatment at that point, and you're probably going to get the best results. And that's what our clinical study did, our clinical study that was published. We actually did the study in men with, specifically, we called it acute phase disease. Mm-hmm. So the men in the study had the Peyronie's disease for less than a year duration. And we saw statistically significant improvement in all the parameters, pain, curvature reduction, et cetera.
Wonderful. So
yeah.
And now compare this to, I had a patient the other day, because this is something that I work with men on. I do prescribe, and we'll talk a little bit more about how that works. But I had a patient comment in comparison to an older calcium channel blocker, verapamil, the verapamil gel that some are aware of out there. What's the difference between the two?
So that's a good question. So the difference between them is it's a different type of calcium blocker. If you remember, I said nicardipine is a dihydropyridine type. That has more collagenase activity specifically for this problem. The other thing is, we as prescribers, when verapamil gel came out, and don't quote me the exact time, but 20, 25 years ago, the data looked very encouraging at that point. The problem is it was all patient-reported data. There was no double-blind studies, which is what H100 has gone through, very precise double-blind studies. Wonderful. So the frustrating thing for the prescriber and the patient was, we heard these great results, but it wasn't reproducible. There were men that got benefit from it, but again, it wasn't a reproducible result. And that's why we took what we thought was a good idea, and I think certainly improve it dramatically.
Absolutely. Absolutely. So talk about those studies a little bit, because I think if you go to your provider, now I'm a family practitioner by trade. I do integrative medicine, so I was highly specialized now. But a lot of, men may approach first their family practitioner, their internist about this, and then be referred to a urologist. And sometimes we'll meet with a little bit of resistance against, these prescriptions. First of all, why do you think that is? And second of all, what can they do to overcome that?
I think it is. There's pushback from the providers, I think, because of the disappointing results with the earlier topical therapy.
Yes.
We were all kind of given this great hope, and it was kind of like, okay, that didn't work out as we had hoped for. So I think there is healthy skepticism, because we all want a new treatment, but we want a treatment that actually has good science behind it. Right. And so that's why when we did our studies, we worked with one of the world's leading experts out of Chicago in Peyronie's disease, and he helped us design the study as he wanted it done, and it was done impeccably, and we saw the results that we have. So what I would say to patients, and when they go into their providers, if they do get some pushback, you can direct them to the hybridmedical.org website, because we tried to make it easy. Right on the resources page, we have a brochure that's good not only for patients, but also for non-urologists, as a quick overview of H100. But then also under it, there are both of the abstracts from our articles. So we have the original study, which showed the good results in a double-blind study. The next study that just recently got published was showing that the H100 got actually penetrated and got into the diseased tissue. And you might say, well, of course it does. Well, there was actually a study with the verapamil gel.
Yes.
We couldn't figure out why it wasn't working. They did a study, and it showed it didn't get into the diseased tissue. So that's why that study, I think, is so important to prescribers to verify that what we are saying can happen.
Absolutely. And I know that men, when they do have the injured tissue, getting in and getting that done as early and intervening as early as possible is truly important. That's where I think the studies are best. What about on a chronic nature, if they've had this for quite some time?
Yeah, one thing I try to always say to people is we like to go by the study data we have. So our study data was only in acute phase patients up to a 1 year duration. I will tell you, in practice, though, I had patients with chronic disease that said, is it okay to try? And I said, certainly it's going to be safe to try.
Sure.
I just can't give you numbers to back up exactly what success you're going to have with it. And I will tell you, anecdotally, there was a man in Minneapolis where I practiced who was scheduled for a Peyronie's disease surgery, who wanted to try it, tried it for 3 months, got improvement, canceled his surgery.
Nice.
So, again, this is anecdotal, and I think that's certainly an area for future research is with chronic patients. One thing I would throw in, interestingly enough, in our tissue study, where it was men who were undergoing surgery for their Peyronie's, and they harvested a small amount of the Peyronie's plaque.
Yeah.
One of those men had disease for 8 years. He had excellent levels of nicardipine, the H100, in the tissue. So we know it does penetrate the chronic. I just can't give you the success we're going to see with curvature, et cetera.
But that doesn't mean it doesn't work, and the research is ongoing. And we approach everything in medicine. We approach it from a benefit versus a risk. And I think in this case, the benefit far exceeds any risk that could be there. And I think it's non-invasive, certainly something easy to try and could be incredibly beneficial. So if a patient is to start this, what can they expect as far as timeline and, getting the prescription, things like that?
Sure. Well, just in the logistics of getting the prescription, we've partnered with PD Labs out of Texas, and they've just done a fantastic job with product. First of all, product development and delivery. It's very easy to use. Very patient and provider friendly in ordering, in receiving, etc. From the patient's perspective, super easy to use. It comes in a metered dose dispenser that almost looks like one of the little clickers you would use for underarm deodorant.
Right.
So there's no how much do I put on? It's literally you turn the click, one click, a small amount of the gel comes out. You apply it to the entire penile shaft. And the reason why we say that, not just right where the plaque is palpable, because there can be small little extensions of that plaque.
Gotcha.
We just want to make sure you cover the whole area.
Gotcha.
And you apply it twice a day. The study, what we did is look at starting point, 3 months and 6 months. And what we saw is statistically significant improvement at 3 months. Okay. And then we saw further improvement in men from 3 months to 6 months. So what we usually say to people is this: try it for 3 months. Just like any treatment, this is not going to work in everyone.
Right.
If at 3 months you're not seeing any significant improvement, I would not do an additional 3 months. But if you have seen some improvement at 3 months, absolutely try it for an additional 3 months.
Absolutely. So we're going to talk a little bit more about getting this prescription and how to. Give me just a little, we got about 30 seconds left. Give me about a short run of where patients can find this information again, the website.
You bet. The two sites to go to are either the hybridmedical.org site, which has sample prescriptions, patient information, provider information, or to the PD Labs. It's pdlabsrx.com.
Absolutely.
And they have a provider tab. The one thing, their provider tab, it is password protected your first time through as a provider.
Yes.
And so for getting a prescription, they just have to go through that one step the first time you use the site.
Absolutely. And I am one of those providers. So you could also go to drpbetterlife.com, find some of my previous information, and certainly, again, to find more information on PD Labs. We're going to take a short break, come right back, talk a little bit more about H100.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Hello, everybody. Welcome back. I'm Dr. Marianne Pinkston here with Dr. Jeff Twidwell, a world-renowned urologist. You know that, right? You know you're world-renowned. So we've been talking about a fantastic product, but we've got a lot more information. I know, my listeners know that I'm really not a big pusher of products. And so when I find something, though, that I think is extremely worthy, focus, then I definitely will hammer it. And I am so glad to have you on today to talk about this, a very difficult topic for a lot of men. And so we talked a little bit about how to get the prescription, getting it from PD Labs, pdlabsrx.com, and hybridmedical.org. But I know you've got more information about, the therapy. It's not just applying something topically. There's actually a little bit of rehab, penile rehab, so to speak, that men could try as well. Tell us more.
Yeah, I think the important thing is with this medication, again, it's hitting the Peyronie's disease from multiple standpoints.
Yes.
To make the medication even more successful, we recommend what we call penile stretching exercises,
yes,
or penile traction. And there's a couple ways to do that. Penile traction is actually a device you purchase, and there's a few different ones on the market right now. They used to be extremely cumbersome devices that men had to apply to the penis and wear for
I'm sure the imagination runs wild on that
my gosh. Yes, exactly. And they, great idea, but, no guy's going to do that.
Right.
Now, some of the newer ones out are shorter duration of wearing, and they're done with very good science to back up their results. So again, I think it can be very helpful. What I have done in my patients, and I found good results, is just doing penile stretching exercises, which literally isn't fancier than its name implies. The man grabs the glands of the penis and then pulls it on stretch. And I have him do that for about a solid minute or so, 3-4 times throughout the day.
Gotcha.
Okay. And what that does is, again, you have a plaque that's softening, breaking down, remodeling, and you are literally stretching. And this has been shown to be helpful both in the data where they use the injection therapy and by itself with the traction devices. Okay. An interesting side note is in our original study that was done, we did not use penile stretching exercises, and we had statistically significant improvement. And so I will tell you, in practice, when we combine the two, which is what the recommendation is now, we've seen even better results with the medication combined with penile stretching or traction.
So there's hope, and that's really, really elaborate.
Absolutely. That's what the guys need to know. There is hope for these people. You're not destined for a bad love life and surgery, etc. For sure.
Absolutely. Yeah. And so where are some of those sites? Again, we're not really connected to any of these devices, but where are a couple of sites? And I can put this on my website as well. Where can they find these?
The traction devices? I think the one that has, I think, the best data to back it up is called RestoreX. And I don't know the exact website of that. But it is invented by a urologist who is impeccable in his honesty and in his study data and all. So that's what I think is so important in this area of research is have good data, and he does have good data to support the use of that.
Great. Yeah, well, I will find that, and we will get that information. I know you guys have an offer for H100. I know mainly not so much just as an offer, but you're trying to get good information. We're trying to study this further. What is, I think, a rebate, correct?
Yeah, what we're doing is for the first 50 prescriptions, there's a $100 rebate at the end of 3 months of treatment. And what the patient needs to do is fill out what's called the PDQ questionnaire, the Peyronie's disease questionnaire. And it's a very standardized, medically proven questionnaire that rates different aspects of the disease. Right. And we want to have that done by the patient at the beginning of therapy and after 3 months of therapy, because it is an actual clinical endpoint that can be utilized, again, as another way to show the benefit of this. We have done a medical clinical study measuring, curvature, pain, etc. We've done a tissue study showing that it penetrates the tissue. Now we would love a patient perspective study driven by the PDQ data. And so for patients who complete that, and it takes literally 1 to 2 minutes to complete this questionnaire. It is not a lengthy thing at all. 15 questions or so.
And you're helping somebody else. So anytime that you're participating a little bit in the research behind something like this, you're always paving the way for somebody else and their improvement and our knowledge base, which we always appreciate. So
yeah, that's a great way to say that. I agree completely.
Absolutely.
And we're trying to help people get better in a disease that doesn't have a lot of good options.
Absolutely. So glad it's out there. Glad you guys are doing this. So tell us again a little bit about where to find this information.
Yep, I'd recommend they go to hybridmedical.org. That's the main website for the product, and it gives a little bit of the history of it. And the brochure and stuff is very easy to understand and approachable for both the patient and their partner to go through. Then again, I think it's a nice thing to have some resources where, again, as you mentioned earlier, they might get a little pushback from their primary doctor or even their urologist. Oh, no, I don't think I've heard of this. I don't want to try it. You could bring in copies of the abstract, one simple page to print off, with a couple of abstracts on it that show good, steady data to support this. And then again, sample prescription there for the prescriber. It's easy. They just fill it out, fax it into PD labs, and they take care of the rest.
Absolutely. And again, another place where if you're willing to do that with your provider, that you are helping others, can help open up a provider, a doctor's nurse practitioner, open up somebody's mind to it. And they'll be more likely to help others as well. So it really is all about that. And that is something, if you do meet with pushback, if you go to pdlabsrx.com and look through their information, you can get a provider to provide this prescription for you. It's a very easy 15-minute appointment. Very confidential. I am one of their providers, so I am happy to do that. And if you do meet with pushback, but I also want people to know PD Labs is one of my sponsors and is somebody I work with very closely. Again, I don't work with people who do not have a good heart or an ethical line. Ray, Solano, and PD Labs do some fantastic work out there. So we are all, Dr. Twidwell and I are all happy to align with them, pdlabsrx.com. But you could go to drpbetterlife.com. That's my website. You can find all of the previous shows that I have. Got about 2 years worth and going now. And Ray and I meet monthly and have a show, and you can find their information and Ray and I and all the things that we've talked about in the past 2 years as well. So Dr. Twidwell, thank you. We got it done. I appreciate you coming on and giving this impeccable amount of information. You've been wonderful. Thank you very much.
Oh, you're very welcome. And it's been a pleasure to be here. And it's exciting to have something to offer men.
Absolutely. So thanks again, everybody. Have a great week.